the 10th of March, for the first time in the country, the Diabetes Association in India has declared the 10th of March as the GDM Day. GDM expands as gestational diabetes mellitus, that is, the pregnancies which are affected with high blood sugars or diabetes, which is, of course, a temporary condition in pregnancy. India has the largest number of gestational diabetics in the world. In fact, the adult diabetes or the type 2 diabetes, China ranks first with 100 million. India is close there at 70 million, and US and other regions are way below 30 million. So India is likely to be heading to be the diabetic capital of the world. 50% of these adult diabetics are women, which means half of them in their pregnancies a couple of years ago would have had gestational diabetes. And if you prevent the adolescent age group, the pregnancy age group, most of them may not have turned into the adult diabetes. Last 30 years, the World Diabetic Foundation, Dr. Anil Kapoor and group have also been working on it. The FIGO, which is the International Association of Obstetricians and Gynecologists, has also established a special working group to tackle this issue, and we feel that public awareness and awareness amidst the doctors themselves is crucial and a very, very major step in limiting the number of diabetics in the generation next. The pregnant woman, first of all, pre-pregnancy, she has to see that her BMI or the weight-height ratio is in the range less than about 25 to 28. That's the first thing. So her diet and exercise pattern should be a change in lifestyle even before the pregnancy, and she has to take certain vitamins like folic acid and B12 so that malformations in the baby are avoided. Early in pregnancy and also in mid-pregnancy, she has to have what is called a glucose challenge test, which will prove or disprove whether she is one out of 5 pregnant women who gets into this problem of gestational diabetes or not. So this test has to be done on every single pregnant woman. It's universally offered to everybody in the country. Once she is diagnosed to be a gestational diabetes case, then she has to pay utmost attention to her diet, exercises, sugar values. She may have to come to the doctor's chamber more often than not. We have to track the growth of the baby, and there are certain issues in and around the delivery time, after which the baby has to be had special care because the baby can also be in trouble. And further, everything is not over after the delivery. The diabetes may temporarily disappear, only to resurface back in the next 5 to 10 years. So every year she must come again for a blood sugar checkup, and she must see to it that her child does not become a case of childhood obesity and early adulthood diabetes. So it is a continuum of care really before and beyond pregnancy, and there are special DIP clinics or diabetes in pregnancy clinics established in few parts of India to offer a focused and special care both to the mother and the child.
Simply log on to gravifynews.com, your one-stop destination for all your news needs.